Hello and welcome to the newest edition of YouTube's one and only cancer-based podcast, Cancer Now. In our last episode, we found out how you are able to differentiate between reliable and unreliable treatment. This week, however, we would like to discuss a topic that we looked at previously, however, from a different angle. Today, we want to ask the question, what doctors think of well-informed patients? My guest, as always, is the cancer specialist, Professor Dr. Herzog.
Yes, hello, Mr. Steininger.
And today is the 12th of June 2020, and this is Cancer Now. Professor Herzog, roughly 2 weeks ago, we spoke about the advantages of being a competent patient. However, recently I read a study in which doctors tend to have a rather paradox point of view towards competent patients. So why do some doctors have such a big problems with well-informed patients?
I know this study, it was at the University of Hanover. They found that doctors not always are happy when patients know too much. And it's very simple to answer, it's just more work for the doctor. So if a patient reads up in the internet lots of information about certain diseases and brings a bunch of papers, printouts about different treatments with him to the conversation or sends it per email, then this means a lot of work. You have to read that, you have to look into that, and then you have to discuss it with the patient point by point. And that's a lot of work. And in particular, after a while, if you work in oncology or in other medical topics for a longer time, you know which discussions are going around at the moment, which claims are made, which miracle treatments or other treatments are on the market at the moment. And so you know quite, as a doctor, it's easier. You can read over the papers faster and you understand soon what the patient means and if that's serious or not, what he shows to you. But sometimes it means a lot of work. For example, you can, if you look in the internet about cancer, you find, for example, the claim that cancer cells eat sugar, and if you leave away all sugar, then you don't have to be afraid of cancer anymore because the cancer cells will die. This sounds very plausible, but it just doesn't work. We discussed this in the past. And you also may hear that very high doses of vitamin C may cure cancer. And Linus Pauling was a Nobel Award winner who claimed that vitamin C could cure all diseases. And this is a long time ago. It is not up to date anymore, this knowledge. But patients still may read it up and come and ask for treatments like that. And so you have to explain again that vitamin C is an important vitamin. It supports the immune system. It triggers some immune reactions, maybe even against cancer, but it's not strong enough in the real life to kill cancer in a way that you can say, okay, instead of taking, for example, a chemotherapy or instead of having surgery, I just take vitamin C. So this means a lot of work for the doctor, but it's very important to discuss all these topics with the patient.
There are examples, because you just mentioned that, in which patients send 30 pages long emails with tons of information for doctors to read. Do doctors or professors like you even have the time for that? Because you have to remember that with too much pressure and too much work, it is easier to make a mistake in your profession.
You have to take the time, so it doesn't make sense to throw all these papers just in the bin and forget them. You have to read through the papers the patient sends to you. You have to look into the questions. You have to discuss with the patient the questions, because if you don't do that, the patient will not trust you so much. The patient will feel that and sense this, that you're not really aware of his personal situation and all his problems. And if the patient senses this, then the result of the treatment will also be worse.
So how strongly can too much information influence the work or the therapy of a doctor?
It can go in both directions. So if a patient is well informed about the treatment, for example, let's take rectal cancer, and the patient is informed already in the internet by other sources that in rectal cancer the guidelines recommend neoadjuvant radiochemotherapy. This means chemotherapy and radiation before doing surgery to shrink the tumor and in this way to allow an easier surgery with less complications. If the patient has read that already and knows this already, it makes it much easier for me as doctor to explain it, because you can discuss this and the patient says, yes, I read this up and I know all the studies about that and that this treatment is of advantage, so I don't have to convince him or her about this treatment. So this can make many things easier. Also, if patients read up certain side effects of treatments, it's easier to discuss them. But, and now this is the point, the patient, if he reads something, he always reads the general information. He never knows as a patient, will this happen to me? Will I get all these side effects which are, for example, written in the text in any kind of textbook of medicine or any other source? Will I get all these side effects at a chemotherapy? You have this information. For example, if you look in the product information about a chemotherapeutic drug, you may find hundreds of different side effects. And this is, of course, very worrying if you read all that and you go to the doctor and you say, oh, look here, I have a list of all these side effects. Now, if I get all of them, I will not be able to live anymore. And then you can reassure the patient and say, okay, of course, every side effect which happened ever has to be written down. But in real life, I would say 95% of the patients don't have all these side effects, and maybe they have, let's say for a certain drug, oxaliplatin, they have a bit of tingling of the fingers and maybe some blood changes, but this will all disappear after terminating the chemotherapy again. And don't worry, and this is very important to tell. Also that you are aware of these problems and that you do follow-ups and monitoring to see if anything happens, to react early enough.
So does that mean that for more complex diseases like for cancers, overall, all doctors welcome informed patient, or is there still the off chance of certain doctors still refusing that?
There are many doctors who don't like informed patients. I know that because patients come to me and report to me that they have no chance to speak with their doctor, let's say about alternative treatments in cancer or complementary treatments. There's just no discussion because the doctor, if the patient comes in and asks, what do you think, shall I look into this alternative treatment? And the doctor closes the book and says, go out of my treatment room. I don't want to answer these questions. You do what I tell you to do, and otherwise you're not my patient anymore. This is quite cruel, but it happens, unfortunately. And it should not happen because the patient has no help. And I think it's a duty of a doctor to really take a patient serious and to discuss with the patient all problems and all questions.
So in the point of view of a doctor, is it a must for patients to know how to filter information? Because you just mentioned it yourself. If a patient thinks that, for example, a different diet would actually help against cancer, wouldn't that have a very strong impact on the therapy?
I mean, the patient cannot filter the information perfectly. Not even a doctor can filter all the medical information which is provided by certain sources, because in medicine not everything is black or white. There is also gray in between. So some treatments may be better for this patient and other treatments may be better for the other patients. Some patients really have to be treated following the guidelines, and for other patients the guidelines are just not possible because there are certain other circumstances. So you have to look for an individual program. So that's not always so easy. And filtering information is, the patient should discuss with his physician then about the information. And this gives him another help for filtering it, because a physician can tell, okay, this is a serious information, this is not serious information, can explain why not serious information is just wrong, and then the patient gets educated and learns more, and the next time maybe even able to filter him or herself better.
So how can you make sure as a patient that your knowledge won't become an issue to your current practitioner?
I mean, for the patient it's just important to gather knowledge, to know more, and he has to discuss with his or her doctor then about the different treatments, and the doctor has to help him then to find the right treatment and to choose the right treatment. And the doctor also has to help the patient that he is not going in the wrong direction. For example, as we discussed, beginning doing a useless, strict diet which weakens him more and even may worsen his condition.
So what does it mean for a patient if the doctor certainly doesn't want to discuss any matters?
And that's a problem for the patient sometimes, because the patient has the information. He has now suddenly conflicting information. The doctor tells maybe this way, and in the internet and other sources and other people may tell different ways. And now, because he's not able to discuss this with his physician, the patient will look for other people who answer the questions, and he may go to some maybe not serious working medical doctor or naturopath or alternative healer, and suddenly the patient is in danger. And these people often have a lot of time to discuss all questions in their direction and with their wished outcome, so that they can offer and sell maybe even expensive treatments which are not reimbursed by any health insurance. So this is indeed a risk for a patient to maybe run into a false direction and choose a false path of treatment.
Could it be that doctors see well-informed patients maybe even as a threat because they might be tested on their knowledge and they might not really like the situation because they are used to know a lot, and now they have somebody in front of them that knows way more than they do?
And that's a good question. I see that with my assistant doctors. So when patients come and they have a bunch of papers and they are well informed about the new studies, the newest guidelines, and suddenly start to discuss the newest guidelines, why plan A and not plan B in his or her situation, and for the young doctor that's too much. Yeah, they are not able to discuss this because they suddenly feel overwhelmed in some way that the patient may even know more than they do themselves, and this creates some insecurity on the side of the doctor. Understandable, but that's indeed can be a problem. Yes, I agree with you.
Could that then, in a way, repel the doctor?
Yeah, that's possible. Yeah, especially younger and less experienced doctors they sometimes have problems to discuss with these patients, especially if every time new information comes up. And I have this kind of patient from time to time. So every ward round I come in, there are new questions, new angles of view, point of view to discuss. But this also can be very fruitful. And I take the time to discuss this, because we also have to see that well-informed patients may also be teachers for doctors, which is a bit surprising if I tell that, but I have to admit that I learned a lot from patients when they say, okay, did you look into this? I read about a new substance, and I myself had maybe not thought about that. Then I say, oh yes, I will check that. And I look in the internet and I find in the medical data banks, there's a study about this new substance, especially in this patient. And then I can find that out. The next time when I see the patient, yes, you're right, there's a small study published maybe in Korea, and they had, in your rare disease, they had a treatment program which is like this, and they tried it and was quite successful. Why shouldn't we go this path? And so I learn sometimes a lot from patients when they are well informed. So it's not only one direction, it's both directions.
I mean, sometimes, however, unfortunately, some doctors don't see that likely as you do. Primarily doctors or professors with a lot of experience, and we are talking about 20 years. How do you think they would feel? Or do you know of a colleague or someone that had to go through a similar case and how he reacted?
Many colleagues don't take, in my eyes, they don't take enough time to talk with patients and to discuss with patients what their problems are and which questions they have. So they don't run into problems like this.
So what does it mean if, for more experienced doctors, let's say 20 to 35 years of experience, that a patient sits in front of them and pretends or said things that he knows way more than the doctor does? So how would they react?
Normally, if you really work in a special field, the patient doesn't know way more, but he may know some details maybe better because he has maybe had more time to read something up or look into certain details, and these patients sometimes have 24/7 time to research. And I think the more experience you have, the easier it's for you to discuss with these patients, because you say, okay, yeah, that's right. If the more experience you have, the easier it's also to accept that patients may also have some knowledge. I don't think doctors, if they believe, okay, I have 20 years experience, the patient is just stupid and I'm the one who knows it the best and I'm the only one who knows it, because that's just wrong. Especially in cancer, it's so difficult, and we don't know if we treat a patient the best possible way, we don't know the outcome sometimes, because although the studies just tell, okay, maybe in 70% the treatment helps and in 30% not. And in the beginning we don't know, is this patient one of the successful ones or one of the poor ones who we treat without success? So our knowledge is limited as a doctor, and you have to be humble and you have to understand that. And then it's also easier for you to accept that patients ask you sometimes difficult questions.
Unfortunately, we are at an end for today, but thank you for coming, and we will see you next week.
You're welcome, Mr. Steininger.
Although doctors have different point of views on competent patients, it is still necessary for patients to continue to find out more about their disease and ways to treat them successfully in order to get the know-how needed to make therapy as effective as possible. In our next episode, we will talk about cancer in kids, how to tackle this effectively, why these cases are so unique, and useful tips for parents to make sure that there's the best outcome possible for your child. And remember, as always, a competent patient is a healthy patient. If you enjoyed this episode, please leave a like and subscribe to our channel to never miss an episode. Or follow us on social media and always keep yourself up to date as possible. This was Cancer Now with your freelance journalist, Benedict Steininger.